I am convinced that what GSK is doing is really step changing what we're doing in the pharmaceutical industry. And I'm going to share that with you today. So we are living our values. We're actually changing how we approach trust with the industry, and we're doing that in various different ways. We incentivize our salespeople to give the right information to our customers so that they can provide that information to our patients. Our data is all open to everyone that wants to see it. It's critical that we have an open door to anyone that wants to see how we progress in our medicines. The other area that we're really focusing on is we have changed our entire operating model. And I'm going to come on and give you a bit more information on that. But the point of difference from a GSK perspective is that we have galvanized our entire organization to make this operating model work. And it's all about putting the customer and our patient at the center of what we're doing. So I'm going to come on and share the new operating model in a bit more detail. And here we are. So right at the heart of what we're doing is the trust agenda that we are living. We're actually living and making those decisions to bring that to life. We are walking the talk at GSK. We're also using our medics to speak on our behalf. We are confident as an organization that we have great people and great people that know not just about our medicines, but the therapy areas that we're working in. We're investing heavily in our digital channels. We've spent hundreds of millions to date in this operating model, and we're absolutely convinced that this is the way forward for the industry. So we're rolling out channels right across the globe in all of our markets, all throughout EMA, all throughout Europe, the US, and Japan. And it's from this information that we're now gathering on our customers that we're beginning to bring in all of that data. And all of that data will start to really generate the insights that we truly need to start delivering what our customers and our patients need. Not what we think they need, but what they are telling us that they need. Capabilities. We're investing extensively in capabilities right across the organization. We've brought in hundreds of people who understand the direction that we're going on. But we're also investing in our people currently so that they can upskill themselves to really be clear about how to drive our business forward. That's starting with our leadership teams. We actually have a lot of our general managers here in Barcelona this week, which has been great for them to see what all our competitors are doing. But they're actually spending some time together as a leadership team, looking at how they're going to lead and drive the change for our business as well. We're investing in our medical teams. We're investing in them so that they feel confident to talk directly with our customers. We're investing in our sales teams as well so that they have enough product information to be confident to give our customers the right information. And then we're investing in our marketing teams as well so that they are absolutely critical clear around how to get the best understanding of our patients on the patient journey, best understanding of our customers on that journey, but they're also clear about the choices they have to make to drive our business forward. So this is the new operating model as it stands. Is it working? Are we seeing some signs of success? And I'd say absolutely. So I'll share some stories from my point of view of what I'm seeing, and then I'll bring you on to share some points of views from our leaders. So I am really fortunate in that I spend a lot of my time traveling around the globe. I have a fantastic role where I meet physicians every day, and I get much closer to understanding what our patients actually need from us. Not so long ago, I was in Vietnam, and I had the pleasure of being with a pediatrician there, a lady pediatrician, who said to me, "I absolutely thank you for making webinars happen at weekends." And I was like, "Really? Why?" And she said, "Well, I'm a busy mum. In Vietnam, we work very hard all week. So to actually get to the weekend and to be able to watch a webinar while I'm cooking dinner for my daughter just makes such a difference to what I'm doing." Another recent example I've seen is when we've been using our own medics to speak on our behalf. This example was from India, where we ran a webinar, And we ran it across 10 different cities in India, so really broad reach in terms of having that interaction with our physicians. The interesting point was it wasn't us launching a new product. We were actually talking about some data that we had in our vaccines business. And the uptake was phenomenal, even more than we could have hoped for. Not only did people join us from the 10 different cities, but we had over thousands of people who joined us remotely to actually listen to what we had to say. So the early signs are really positive around our new operating model. So do we have any challenges? Is it all rosy for us? And I would say no, it's not. We're definitely still on the journey. And if I had to reflect on one thing that will really help change and drive our business forward, is around the mindset that we have. To absolutely feel conviction in believing that this is the right thing we're doing for the industry. And I believe it is.